really see very consistently over multiple decades that Black, Latino, Asian, and Indigenous youth have less access to mental health care than white youth. And this is even at the same level of need. So you're looking at, a situation where there's the same condition or the same severity of condition, and you see much lower access to mental health care. And part of what that's led to is we do have research and evidence showing that for Black and Latino youth, Black and Latino adults, you can get to higher levels of severity of those mental health conditions because of the lack of treatment. And so some of the, challenges for Latino youth, for example, is, among youth under 18, you've got the highest rates of uninsurance or underinsurance for Latino youth. You have barriers for Latinos and other immigrant groups, such that if the parents speak a language other than English, it's harder to get a usual source of care, to find a therapist to work with you and to be able to involve you in treatment, which is very important for young people to have families involved in treatment. So there are multiple barriers that persist. And one of the areas that we've focused on in my research group around is having to do with the impact of structural racism on these systems, and just the notion that what we're seeing really is that funneling youth of color, funneling Black, Latino youth into systems that are punitive. And so youth are more likely to get into kind of a behavioral referral at school, a disciplinary referral to be treated within the child welfare system or the juvenile justice system, rather than getting that kind of specialty mental health care that they need in settings that are supportive.